Erin, it's good to see you again. Thanks for joining us.
Thank you so much for having me, Peter.
The last time I spoke with you was when you were running to join the city council in the city of Indio, but now I'm speaking to you from your perspective as a registered nurse in the Valley. What is the message that you want people to hear?
The message that I want people to hear is right now during the pandemic, we're seeing nurses working out of ratio. Nurses typically take, if they're in the ICU, they typically take 2 patients because the patients are such high acuity. On med-surg floors, it's typically 5. Um, the county and the state are giving waivers to our local hospitals to have nurses work out of ratio. Um, Evidence-based practice shows that to have better and safer patient outcomes, you need to implement those ratios. Obviously, we're in a pandemic, and so we're going to see things that are different because of this emergency. However, hospitals now have not canceled elective procedures, so they have the resources, and some are doing more than others. However, we're seeing that while some are following their disaster protocols and their disaster plans, some are still in profit mode, doing surgeries and doing business as usual, and this needs to stop. Also, I've reached out to several elected officials. I've reached out to Supervisor Perez, Assemblymember Garcia, and Congressman Reese, so that I can express my concerns for the nurses in our communities. Partisan politics, it needs to be taken out of this matter. Our elected officials, they need to work together to really back up and support our nurses, so that our nurses can continue to support our community members.
It's interesting, Erin. I saw that you posted on social media recently something very emotional about how difficult it has been inside the hospital for nurses. What can you tell us about that?
I'm currently working a travel contract in Imperial Valley. However, as a former nurse rep for CNA, I still have many contacts with our registered nurses here in our community, and I still work locally as well. We are seeing something that we've never seen before. It's like a war zone. And we're getting to this breaking point, and it's very scary for us to see or to wonder what's going to be happening in the next week or two. ICU capacity is maxed out, and while you can make more beds, you cannot make more ICU or ER trained nurses. This is a highly trained specialty. So, we have lots of nurses that can go in as helping hands, but things just as simple as charting a patient are a special assessment. Some of the nurses that have reached out to me about their concerns is that 80% of their time is focused on charting. We need the governor to take a look and waive our liability during this time while we're working out of ratio. We need to have more protections so that we can also be working in an emergency capacity, looking at less charting, looking at how we can safeguard our patients by halting these elective procedures, and looking at other ways that we can protect our nurses from disciplinary procedures by the BRN and by their employer.
Are you hopeful now that there's a vaccine that things will improve very soon for nurses and other medical workers?
Well, I think that we'll see some improvement, but it's going to take some time. Those vaccines are first going to come for, those that live in skilled nursing facilities, that elderly population that lives in assisted nursing facilities. However, the staff that's going to get those vaccines, it's going to take 7 or 8 weeks for that to really take full effect. I don't think we're going to see a difference in our hospital admissions for quite some time. So the next few weeks, the end of this 2020, are going to be some of the most difficult that we've ever seen. And it's something that most of us never expected to see in our lifetime.
All right, Erin, we appreciate your time. Thanks for joining us.
Thank you so much, Peter, for your time today.